Of course, you've already heard a lot of these questions from me and others during the press conferences. I kind of want to focus more on the specifics of some of the major decisions. And as I'm sure that you already know, I talked to Cohen and Sprayberry earlier this week, and I kind of wanted to get from you what the day-to-day is like during this time period, since it's been almost 6 months now, 5 months. How does your day start during this time?
Well, there are hours and hours of meetings, video conferences, phone calls. I get briefed every single day, even during the weekends, by members of the Department of Public Safety and Mike Sprayberry, by Mandy Cohen and Department of Health and Human Services. And it's a lot of data coming at you. Briefings provide a lot of information that we need to use to make the decisions moving forward. A lot of doctors, data specialists, attorneys that are on the line, usually some senior staff, and there are hundreds of people involved in collecting data, analyzing it, getting input from people all over the state, public health departments, schools, businesses, and it all gets condensed and summarized, and it's brought to the meetings that we have. And they can last a long time because there's a lot of areas to cover when we're making decisions about the health and safety of North Carolinians. It's important to make sure that I understand all of the details. So generally I ask a lot of questions. I spend time at night, unfortunately, propped up in bed, reading a lot of reports and studies, and I'm usually armed with that the next morning when I'm talking to Dr. Cohen and Mike Sprayberry regarding where we are with our PPE, how many ICU beds do we have, what's the latest data that we're hearing from where the clusters of the virus are. And these are important decisions that affect the health and safety of everyday North Carolinians. So we try to use all of the information available to make the best decision possible going forward. I make the final decision as to what goes into my executive orders. We knew in February and March that we had an issue with the potential of this virus coming to the United States, and we set up a task force pretty early. And of course, there have been pandemics in the past, and there have been a lot of studies about things that you do. So we engaged this task force as in what the kind of things that we would have to do potentially to slow the spread of the virus. And it went on from there. We had to make some tough decisions fairly early about having our schools go in March to all remote. We had to make decisions about limiting mass gatherings and closing bars and restaurants for a period of time, and making decisions about these entertainment venues that were bringing large crowds of people together. We eventually, of course, did a mask mandate to make sure that we were slowing the spread. And we took all of that information and made these decisions in a cautious way. And we've been cautious and slow about easing restrictions because we're keeping the health and safety of the people at first. And one thing I've learned is that you need a state government that is operating at a high level with great efficiency. And I'm proud of the fact that we have pulled together an excellent team of people. We've leveraged using our universities. And it's been, I think, a very thorough experience in that we've made good decisions based upon the best available data and science. These decisions are not going to make everybody happy, but it's not about making everybody happy. It's making the best decision and making decisions about what's going to happen up until the last minute, because data continues to come in. And one of the things about this pandemic is we've learned a lot about it as we go along.